Hi, welcome. If you don't know me, I'm Anna, clinical psychology doctoral candidate. This channel is all about applying psychology to our real lives. Today we're talking about imposter syndrome. This is another one of those highly requested videos, so I really hope that it can be helpful to you. It's something I've been putting off for a long time because it's something that I really struggle with, which we will get into momentarily. But this video is going to be all about what is imposter syndrome, who has it, what negative outcomes is it associated with, and some tips to overcome it. Right off the bat, what is it? Imposter syndrome is the fear of being outed as a fraud or imposter or someone incompetent in their field despite being competent. So obviously this wouldn't apply to people who feel incompetent and are incompetent, but people who feel like they're a fraud and actually really put in the work and have valuable contributions to usually the professional sphere where they work. One of the articles that I looked at, by the way, references in the description box, said that imposter syndrome is when high achieving individuals think that their success is due to external outcomes, so thinking that it's luck or an oversight on someone else's part, rather than individual competence or achievement. People with imposter syndrome aggressively pursue achievement while not being able to accept the recognition once their achievement is actually achieved. So who has imposter syndrome? The rates in the research are between 8 to 89%, so a very large range, but it can be and usually is a very high proportion of people. It seems to be something that plagues particularly disadvantaged and underprivileged people in particular. So people like minority groups and women and immigrants. Interestingly, it's not the privileged people who have the most imposter syndrome like you might expect. The people who we might expect to be concerned that their success is undeserved or the byproduct of being born lucky or rich or privileged. People like Kylie Jenner and the Hadid sisters who self-proclaim as being self-made by themselves and their family members. They actually seem to be the ones who want to assume the responsibility for their wealth or success or fame, rather than the people who actually clawed their way to the top. One of the articles that I looked at said that it's not just an individual or clinical issue. It's not just a syndrome that we should pathologize in the individual, but rather a sociological issue as well. So why is it that so often the people with the most resources assume that their success is the result of hard work, whereas people who have to fight tooth and nail to get where they are assume that they're a fraud and that it was all just a stroke of luck? If we think about it, if you come from an underprivileged background, you rarely see people who look like yourself in positions of high power. You might internalize the message that if you're at the bottom of the totem pole, it's because you deserve to be there. So once you actually claw your way up the social ladder to the top, you still hear that message echoing through your head. You still hear, you don't belong here, you're a fraud. Underlying this message is the notion that people who are at the top, so people like role models, politicians, celebrities, rich people, are exceptional and have done exceptional things to deserve being there. So when you get to the top and you don't feel very exceptional, you feel like an imposter, you feel like you don't belong, you feel like you're one misstep away from being outed. Listen, I'm not saying that people who are at the top are not sometimes exceptional. I think the truth, like with most things, is somewhere in the middle. Both privilege and hard work tend to affect how far a person in life gets. Of course, there are some people who have very little privilege, work their ass off, and still aren't able to climb up the social ladder very much. And of course, there are some people who have a lot of privilege and it's still not enough to make them successful. But if we zoom out and take a look at society as a whole, rather than specific individuals, I think being both privileged and hardworking is a pretty good formula for success. Anytime someone tries to convince you that it's either one or the other, solely privilege, solely hard work, they're probably being a little bit too reductionistic or trying to spin a narrative that fits their agenda. So people from disadvantaged groups tend to have more imposter syndrome because of this reason. Women also tend to have more imposter syndrome. In a systemic review on the research on imposter syndrome, 60% of the 14,161 participants were female. Some of the studies did find statistically significant differences by gender, while others didn't. The bottom line is that imposter syndrome is more prevalent in women, but it also affects many men. Minority groups tend to also experience higher rates of imposter syndrome, such as African American and Asian American populations, due to things like lack of adequate financial aid, the need to work to support themselves in school, racial discrimination, enduring negative stereotypes, which we know negatively affect performance, being the first in their families to pursue advanced education. All these issues make it more difficult for racial minorities to see themselves like they belong in high up places, which is why it's such a big deal when something like a Black woman shows up on the Supreme Court for the first time. One study found that imposter syndrome feelings are stronger predictors of mental health than minority status stress. In other words, feeling like an imposter is worse for your mental health than experiencing prejudice or discrimination. This seems a little hard to believe, but it's what one study said. Students also tend to have higher rates of imposter syndrome a lot, especially students with great fear of imperfection. Makes sense. Students are in a position of lower power. That's why it's unethical for people in teaching positions to be intimately involved with them. You're in a role where you're expected to learn from people, to listen to what other people are saying, so why would you be the source of authority on anything? I definitely struggle with this. Like, to be honest, like I said, I have pretty bad imposter syndrome, and before every single video, I ask myself, who the hell are you to be teaching people about anything? You're a student yourself. It takes constantly reminding myself that yes, I'm still a student, but I have 8 years of education in psychology under my belt. I do work really hard. I do overtime on topics that interest me. I do have qualifications to speak about psychology, definitely more than most people spreading misinformation on social media. I have a bachelor's and a master's in this. I'm really close to my doctorate. So it takes a lot of reminding myself to not completely blow up this channel off the internet, because sometimes, I'll be honest with you guys, I really consider it. Younger people also have worse imposter syndrome. The older you are, the less imposter syndrome you're likely to have. For example, I remember having this conversation with my therapist one time, and she was saying she feels so much more confident in herself now that she's a little bit older, has some time under her belt. This is one of those things that I feel really strongly intersects with gender. Young women are constantly given the message that we don't know what we're talking about. I get comments on my videos all the time being like, who is this 15-year-old? She has no life experience. Or, I misjudged you before clicking on this video and I was surprised to hear you actually have something intelligent to say. So while young people in general are definitely taken less seriously, and women in general are taken less seriously, that intersection between young and female is an absolute killer. In group supervision at my current practicum site, me and another one of my female classmate externs were wondering why we get so many clients who ask about our age. And our male peer said, oh, I haven't really experienced that. Our supervisor, who is a woman, let us know that in her experience, young women really get the brunt of being treated like imposters. So if you're a young man, it might not be as bad. If you're an older man, definitely not going to be as bad. And if you're treated like an imposter, no matter how hard you work, of course, at some point you're going to internalize those messages and actually feel like an imposter. So what are the effects of imposter syndrome, or what are the things that are correlated with it? So it's kind of like one of those things, what came first, the chicken or the egg? We don't really know in correlational data. We can't confirm causality, but some of the things correlated with imposter syndrome are in employees, greater burnout, stress, decreased job performance over time, and more delegating tasks to colleagues. In general, it's associated with greater pessimism, perfectionism, depression, anxiety, somatic symptoms, and social dysfunction. It's associated with lower mental health, self-worth, support from others, self-esteem. In students, it's associated with greater academic procrastination or compulsive completion of assignments, as well as doing worse on exams. So clearly, it's not a great construct that you should have in your life. Ironically, feeling like an imposter may actually decrease your performance, which can in turn kind of turn into a self-fulfilling prophecy where you do become an imposter. You are becoming worse at what you do. So how do you overcome imposter syndrome? This section is going to include some tips both from the literature as well as my own suggestions. Definitely something I should take my own advice on. Let me just say, there is a very real shortage of information on how to treat this phenomenon. There is no quick and easy fix, but I will try to be as concrete as possible, so I hope that this is somewhat helpful. The first step is to realize that it's even happening. Realize when your imposter syndrome is kicking in. Become mindful of your own inner monologue and catch yourself when you're putting yourself down or telling yourself that you're an imposter. Label it as such. Take away its power by reminding yourself that it's not real, it's lying to you. If you fit the profile of a person who is prone to experiencing imposter syndrome, female, young, minority group, perfectionistic, student, high achiever, mental health struggles, multiple of these identities, you're the most likely candidate to develop imposter syndrome. This isn't an indication of your abilities. It's not just a purely individual or clinical problem. It's a societal problem too. You've been fed this message that you will never be good enough, you will never amount to anything, you don't deserve success. But it's not about who you are as a person. It's not a you problem, it's a social problem. Prove the haters wrong. So that's the first step. Be aware when it's happening. Catch yourself before you start to spiral. Second tip is to get social support. Talk to other people who experience imposter syndrome. Realize that it's very common and usually has nothing to do with the other person's competence. So usually your peers who are working very hard are the ones who are having this issue. Actually, the harder the worker, the stronger their imposter syndrome tends to be. So if anything, treat this as an indicator that you're a high achiever and a perfectionistic person whose traits will go a long way to bring you to success. Also talk to other people in positions of power or authority to realize, first of all, they're not superhuman, and oftentimes they too had to push through imposter syndrome before they came into their own. Try to find a mentor, try to tell them about what's going on and have them normalize that for you and give you some guidance. Number 3, accept imperfection with self-compassion. No one is perfect, not even those at the top. I would argue especially not those at the top. Like, I have a very, very low impression of people who are like politicians and celebrities. Like, would not trust them. Try to lean into constructive feedback non-defensively. It's not an indication that you're an imposter, but rather an opportunity for you to grow and prove yourself. Because if you're not paying attention to what your weaknesses are, what your growth edges are, then how are you going to become successful? Be honest about your own shortcomings. Don't try to mask or deny them. It doesn't make you a fraud to still have things that you need to work on. And being self-compassionate means treating yourself kindly even when you're suffering. It means opening your eyes to reality, even the parts of yourself that you don't like. It means acknowledging that all humans are imperfect. All humans have things that they don't like about themselves. They sometimes make mistakes. They sometimes feel inadequate. So maybe there are some things that you're not so good at. That's okay, it's only human. Certainly you can work on it, try to improve it, but it doesn't make you an imposter. Number 4, track your successes. Don't just track your weak spots, but also keep a running list of the things that you've accomplished that you're proud of. It could be finishing undergrad, getting your master's degree, getting a promotion at work, getting a glowing letter of recommendation from your boss, running a 10K marathon, learning how to fly a plane, working out consistently, reading a book a month, writing your own book, anything under the sun. Also keep a running list of all the nice things that people have said about you. It's easy to focus on the one negative thing and completely disregard the 100 other positive things that you've heard. So having that in writing can serve as a good reminder when you're feeling like an imposter. I personally don't do this just because I want to move away from deriving my self-esteem from other people's opinions. But there are certain things that like really stand out to me when I think about it. Things like people on YouTube who say that my videos help them get past abusive relationships, or people in real life who have used a word to describe me that really touched a chord. Some of the things my clients have said when we've debriefed about how therapy went for them have like at least a few things that really move you and really make you feel like you're making a positive difference in people's lives. Number 5, turn a tragedy into a triumph by using your imposter syndrome to get you further. Your imposter syndrome can be a tool if you utilize it the right way. Ignore the voice that tells you you're a fraud, but do work overtime to prove to yourself that you're not. When I think about my haters or the people that pointed a finger at me and said you're an imposter, either because of my gender or my age or the fact that I'm a student, I use that to motivate me. I look forward to the day next year when I get my doctorate diploma, when I get licensed as a clinical psychologist, when I hit the next big number of subscribers that I'm aiming for, because I will be able to prove those people wrong. My imposter syndrome, it only makes me do more research, read more books, think about things more deeply, push myself outside my comfort zone. All of these things will prove very useful in the long term. So set goals for yourself, aim high, and work hard to accomplish them. Let the haters be your motivators. And lastly, number 6, patiently wait for time to pass. I think this is really the most important piece about overcoming imposter syndrome. And sadly, it's one of those things that you can't control. The reason why it's so difficult to come up with tips for handling imposter syndrome is that its antidote is not something within your control. It's something that just happens anyway if you can just be patient. the passing of time. Time heals many things, but it especially heals imposter syndrome because it lets us move to a place of greater gender and racial equality. It lets people go from students to practitioners. It lets people get older and more experienced and so forth. So just be patient in the knowledge that one day, maybe 5 or 10 years from now, you'll no longer feel like an imposter so much. And until then, try to enjoy the ride. There are some good things to enjoy about being young, being a student, being the underdog on your way up the ladder. Enjoy the moment. Just wait for time to patiently heal you. Do you struggle with imposter syndrome? If so, I really hope that this video helped reassure you a little bit and gave you some concrete tips to take. Please let me know what you thought about it. If this is something that you've struggled with and something that you've found strategies for, I'm always wanting to learn about that. And I hope you have a great day.